we might think about what patients need, we might imagine what they would like. The reality is always more complex than our imagination with respect to that.
Klaudia, let's begin with your story. What led you to where you are today as a researcher?
So I started a master's of cognitive systems and interactive media, and it was 8 years ago where my story with digital health started, and I started investigating the principles of the recovery from stroke. The idea was to be able to provide patients with evidence-based therapy to recover motor functions, cognitive functions, and language functions after a stroke. People are actually being delivered the therapy in the context of gaming. If we know that for therapy to be effective, you need to visualize, let's say, your hand movements from the first person perspective. We first test this feature in a clinical study. We measure whether this is the case or not, and then we implement the feature to the game. And any other component, the reward component, so how much reward do I need to provide for therapy to be effective, for therapy to be motivating, for the functional gains to be observed.
Wow, that's amazing, and it's also very much in the realm of the future of digital health, or the future of healthcare, I should say. And so it's wonderful to see how far we've come, because you read about these things, but you don't often hear about what the researchers are doing behind the scenes. So what elements of physiological, psychological, and behavioral functions have you seen integrated into digital solutions? And what elements do you find are the easiest or hardest to influence? You talked about rewards, and I've often had debates with people around rewards and incentives, and how that might work in a behavioral change context and a digital application. So I'd love to hear from you on that.
So in our case, for example, like in case of behavior, so behavior change is very critical. Also, having experience with the patients themselves gives you a lot whole new perspective on the user. Patients are we might think about what patients need, we might imagine what they would like. But that is always different, or the reality is always more complex than our imagination with respect to that. So I think that there is a critical need to really understand your end user. And there are different components, let's say in stroke. My major contribution in the system was the development of the language rehabilitation protocol. And this language rehabilitation protocol is based on many principles, let's say, about how the language works in the brain. Stroke can cause us to lose the ability to speak, or lose the ability to understand, or lose the ability to move. So let's say standard therapy looks at the rehabilitation in a very standard and often not evidence-based way. So we would repeat words in a patient-therapist scenario. We would do syllabification and similar things. While language is not really acquired in this way. So if we have kids learning a language, we see them using them to obtain their goals. We see them interacting with objects, using a lot their motor system as well. So we tested the principles of this behavioral relevance in the language processing, and we integrated this into this VR-based therapy. So now we have two patients playing with each other. So the objective is to request objects, and they have the motivation. The goal is not linguistic, the goal is behavioral. We now know that so concepts are multimodal. So sometimes when I hear the ringing of the telephone, these areas of the brain that are related to the reading of the phone are active, and vice versa. Similar, for example, when I smell cinnamon, my language areas would be active, or when I read the word cinnamon, my olfactory system would be active. So we see that language is very mental model. It requires the body and it requires all the sensory system. So let's say in this case, we're integrating all these things, we're testing them first on healthy subjects, then in clinical studies, and then we integrate them into a therapy, which seems to be effective as compared to the standard therapy, especially at the long terms.
You notice, because I'm assuming you're using different patient groups, right? Obviously, when you're looking at healthy people versus the treatment group, and a lot of the diseases like strokes, for example, generally impact people later in life, right? So do you notice that you have to do quite a bit of education in terms of how to use the application and the digital therapy?
So you feel like the digital solutions are out there, but there is a kind of skepticism with respect to their use, both from the clinical side sometimes and from the user side, because maybe there's patients are scared to use something that they would not understand. So the patients, we're educating the patients of what is there is actually happened to them, how their disability is controlled by the brain, by the body, and what are the consequences, and how the solutions that we provide are indeed useful, and also the clinical part that is behind that they might not be aware of. The same goes to the clinician. So let's say we come from the neuroscience, and often neuroscience is kind of neglected, like the brain component in the physical medicine is kind of there is a gap. It's which is a pity, but I think we're working on it. But sometimes, let's say, the traditional medicine approach is to cure the symptoms. So there is this physical rehabilitation where you're actually, let's say, moving the hands or repeating the words depending on the disability. While if you look at how what's happening in the brain after lesions such as a stroke, you understand that great bunch of stuff is happening there, and it could be through the neurorehabilitation that you can actually regain a physical function. So, and this is where we also provide tutorials and sessions to educate everyone in the loop. That's being medical doctors, that's being people from rehabilitation, that's being patients and their family members. That is also very relevant, that they know what's going on with their loved ones.
Yeah. Wow. There's so many things to think about. So yeah, kudos to you and your team, because that's a lot of work. And like you said, education is critical, right? Education and awareness is power. And so it's important to make sure that every stakeholder feels empowered if we really want to evolve the system. Thank you so much for tuning in and learning with us. What's clear from this interview is that the clinical validation of physiological, psychological, and behavioral research is critical to the success of the field of digital therapeutics, and specifically in its potential to transform healthcare from sick care to prevention and improved quality of life. The rise of digital therapeutics is intended to help us all envision a better healthcare system for the digital age, one that encompasses mental health care and prevention. If you like what you see, please follow along our journey. Thank you.